Welcome to Jersey Matters and welcome to my home. This is Larry Menti. For the duration of the coronavirus, like many of you, I'll be working from home. On this week's show, we will talk with Dr. David Alland, one of the nation's leading experts on infectious diseases from Rutgers, who came up with a new COVID-19 test that is a game changer. We will take you to 2 New Jersey public testing sites to find out how things are going. New Jersey businesses are having a difficult time paying their employees, but they have emergency help coming. We'll tell you what's available and how to get it. And New Jersey Shore communities are pleading with summer homeowners to stay away during the pandemic. And now, my interview with Dr. David Alland, Chief of Infectious Diseases at Rutgers, New Jersey Medical School, who helped develop a new COVID-19 test. Dr. Alland, first of all, thank you so much for doing this. It's exciting times for you, and I know you're busy because you and your research team have come up with a new test for COVID-19. Why is this test different?
This test is different because instead of taking your test to a research lab or a large technical laboratory, the lab comes to you in the form of a plastic cartridge that does all of the analysis. It does have to be inserted into a machine, but all the prep work, all the sample processing, all the analysis is done in the small plastic cartridge. And so it lets the test be done much more rapidly because it doesn't have to be set up in any way. And it lets the test be done potentially at areas outside of a large laboratory, much closer to the patient.
So how long does it take to get results with the current test, and how much faster will it be with the test that you developed?
So the test that we've worked on has a less than a 45-minute turnaround time. So from the time the sample gets to a laboratory to the answer is about 45 minutes. Current testing now is taking somewhere between 5 hours and 5 days.
Wow, that can be a real game changer. Talk about what difference that makes for the person being tested, for the health system, and for doctors and for hospitals. What that means to be able to get test results back that quickly.
Well, imagine you're a doctor in a hospital and you have 10 rooms to put patients in that are safe rooms that isolate the COVID virus from other patients. And you have 20 patients who could have COVID but could have another disease. Which patients do you put in those rooms? When you run out of rooms, which patients can you put together? You obviously don't want to put together 2 patients, one who has COVID and one who has a fever for another reason. That's a way to spread the disease from patient to patient. And if you're not getting your result back until 5 days later, that test isn't going to help you at all. So you really need to be able to make very quick decisions based on actual knowledge of who has an infection and who does not.
Just for you and I, or anybody that is watching right now, if you are told you have COVID-19, even if you're not showing symptoms or have mild symptoms, you have to quarantine for some time after that. With this, they're still asking people to stay inside, but at least you don't have to stay away from your family. At least you can interact a little bit and get back to a normal life. So when will this be available?
So what you're describing, which is testing relatively healthy people, is something we would love to be able to see done. But at least initially, with the number of tests that would be available, this test is going to be really used, I think, principally in the hospital to help sick patients and also to help physicians and other healthcare workers know who's sick and who's not from COVID.
Actually, that's Dr. I'm sorry, Doctor, that wasn't, I'm glad you said that, but that isn't exactly what I was talking about. I was talking about people that were going to get tested that showed symptoms and may not have COVID-19. That's what I was talking about, just to be clear. But please go ahead.
So the company that makes this test, named Cepheid, has said that they will be releasing the test the week of March 27th. So that's very soon. I will guess that there will be a ramp-up period where there'll be increasingly large numbers of tests. And they should be distributed across the country and hopefully across the world.
And so you're saying around the world, are we talking by At the end of April, everybody will have one. At the end of March, everybody will be able to have one?
For now, this test is going to be available in the United States. That's where the approval is. We will, of course, be working to help get approvals elsewhere so that the test will become more widely available. But for right now, we're talking about the United States. You're correct.
Dr. Alland, you work at Rutgers University. You are affiliated with Clara Moss Medical Center in Belleville that has an affiliation with Rutgers as well. That's an area, North Jersey's an area hit hard by this pandemic. They have to be extremely excited about the new test. Do they get to the front of the line? How fast before they get the test?
Rutgers has two medical schools and two principal teaching hospitals. I would imagine that in both places, they will have cartridges available relatively soon. I couldn't give a precise date on it. I'm not the person involved in making those decisions. I don't work for the company, Cepheid.
Dr. Alland, I'd like to take a moment, if you don't mind, just to fact check some of the information that's being disseminated by our public officials. Governor Andrew Cuomo, during one of his briefings, said that it's expected that 80% of the people in this country are going to get COVID-19. And then the health commissioner from New Jersey at one of Governor Murphy's briefings said that she expects everybody, 100% of the people, will get the coronavirus. Do we really know how many people are going to be infected?
We definitely do not know. This is a new disease. We can make assumptions and guesses, and those guesses are important to make models to understand where this outbreak is going to go. But when we make those models, we make usually a series of assumptions. We make assumptions that 10% get infected, that 30%, that 80%, that 100%, and build models based on all those assumptions to give us a range of possibilities of what's going to happen. But no one can predict right now how it's going to go at this point, for sure.
Are the projections you've seen anywhere close to 80 or 100%?
I have seen projections along all of those ranges. I think that the consensus is probably getting something closer to above 50, but certainly well below 100%.
Why is this disease so infectious? Do we know?
These are really interesting questions. Unfortunately, the answers are going to take a long time to come. We do know some things. We know that this is a new strain of virus, and so it's unlikely that anyone has immunity to it. And so, unlike all viruses that circulate commonly in the community, there's usually some degree of immunity to those viruses. So when they come into a community, they don't infect everybody, or they infect people and don't cause disease. Well, with this virus, it's a complete blank slate, and so anyone that's exposed has a much higher chance of getting infection and a much higher chance of progressing to disease. If this virus comes back over and over again, it will probably look more like influenza than it does now.
Dr. Alland, there's a few hot spots in the world right now, and unfortunately, North Jersey and New York City is one of those hot spots. What does that mean for us in terms of the response, what we can expect, and the future?
Well, I think that the hotspots that we have now are just what's going to happen to other places in the future. We know with these type of diseases that infections come first and sickness comes later. So what you're seeing now is the consequences of what happens 2 weeks ago when people started getting infected. So even though other areas may not have a ton of disease right now, the fact that they have a few sick patients in virtually every state in the United States suggests that there's a lot of transmission going on in all of these states, and their future is likely to look a lot like ours if they don't go very dramatically into social isolation now. Well, things look good, but really aren't. We just can't detect all those infections.
Oh, that's a great answer, but we're looking at some of the hot spots where it started early in China and in Singapore and in South Korea. And we keep talking about flattening the curve here. There they have, it seems, flattened the curve. What can we learn from them?
We can learn that social isolation is absolutely critical. You have to keep people apart. so that they don't transmit COVID-19 virus to other people that are currently uninfected. And we need to do widespread testing to know who needs to be quarantined. And those are things that we really haven't done to the degree necessary in this country.
In a moment, more with Dr. Alland, who tells us what we need to do right now to end this pandemic. That's when Jersey Matters comes right back.